How to use TENS for sleep apnea. If you're struggling with sleep apnea and the idea of using a CPAP machine doesn't appeal to you, you might be interested in a newer, more convenient option: transcutaneous electrical nerve stimulation, or TENS. Let's break down how you can use TENS to help manage your sleep apnea. First, you need to understand what TENS is. It's a small, battery-operated device that you can use at home. This device is typically used for pain relief, but recent studies have shown it can also help with sleep apnea. To use a TENS machine for sleep apnea, you'll need to set it up before bedtime. Here's how you do it. You attach electrodes embedded in sticky pads to the base of your neck and upper back. These electrodes are connected to the TENS machine, which delivers light electrical pulses to the nerves and muscles in your neck. The key area targeted by these pulses is the hypoglossal nerve, which runs from the base of the brain down to the tongue. By stimulating this nerve, the TENS machine helps keep your airway open during sleep, preventing the breath-holding episodes that are characteristic of sleep apnea. When it's time for bed, you simply turn on the machine. The electrical pulses are continuous but gentle, so you shouldn't feel any discomfort. You can adjust the intensity of the stimulation to a level that feels comfortable for you. The study that tested TENS for sleep apnea involved 56 patients who had trouble adhering to CPAP therapy. These patients used the TENS machine for at least 3 months, and the results were promising. The patients saw an improvement in their apnea-hypopnea index, which measures the number of breathing pauses per hour. On average, their AHI score dropped significantly, and they also reported less daytime fatigue. It's worth noting that while TENS is effective for many, it may not work for everyone. For example, people with a higher body mass index might find the treatment less effective because the electrodes may be farther away from the muscles they need to stimulate. In terms of side effects, they are generally minor. Some patients reported mild headaches and minor skin irritation where the sticky pads were attached, but these were rare. To get started with TENS for sleep apnea, you should first consult with your doctor. They can help determine if this treatment is right for you and guide you through the process of obtaining and using the device. Overall, TENS offers a non-invasive, cost-effective alternative to CPAP therapy for managing sleep apnea, and it could be a game changer for those who struggle with traditional treatments.